Okay, so welcome back to this next video in which we are discussing diabetes mellitus and anti-diabetic drugs. Okay, right, so we've just discussed 4 different types of diabetes mellitus. We've discussed the main 2 types, type 1 and type 2 diabetes mellitus, of which the most common is type 2 diabetes, and then we've also discussed an example of a monogenic form of diabetes, which is MODY 2, maturity onset diabetes of the young 2, and also we've discussed gestational diabetes, which occurs during the gestational period. Okay, right. Now, the thing that they all share in common is that they cause hyperglycemia in the fasting state. Okay, so too high blood glucose concentration in the fasting state. Okay, and they also cause the postprandial glucose spikes to become not only taller, but also broader. Okay, postprandial glucose spikes problem. Okay, and that's in the fed state. Okay, right. What we now want to discuss is how is diabetes going to present? How is hyperglycemia and these large postprandial glucose spikes going to actually present? Okay, so basically there is what is known as the classic triad of diabetes, okay, which is the classic 3 symptoms which you can use to suspect diabetes. Okay, you can't actually diagnose diabetes until you have those fasting blood glucose concentrations of greater than 126 milligrams per deciliter or 7 millimolars, and you need to remember do that twice on separate occasions. Okay, however, these classic triad of symptoms will certainly help you to spot cases of diabetes. Okay, right. So what are the 3 symptoms then which characterize diabetes? Okay, so they are polyuria, polydipsia, and polyphasia. Okay, so let me explain what each of these means. Polyuria means that you have to urinate more often. This is the symptom after which the entire disease is named. Diabetes, remember, meant excessive urination. Okay, so polyuria means excessive urination. It means effectively the same as diabetes. Okay, right. Then the second one is polydipsia. Okay, and this refers to having to drink too much. Okay, so you have to drink, you're thirsty all the time, drinking all the time. So polydipsia refers to too much thirst, basically. Okay, and then finally, polyphasia, which means that you're hungry all the time. Okay, so hunger goes up. Okay, right, so those are the classic 3 symptoms of diabetes, known as the classic triad of diabetes. So let's discuss why having hyperglycemia chronically is going to cause these 3 symptoms. Okay, so let's draw some pictures for this. So if we have our blood here, okay, and let's say our blood glucose is chronically too high, okay, because our fasting blood glucose is just too high all the time, basically. So glucose is always high within the blood. Basically, what starts to happen is the kidney starts to excrete glucose in the urine. Now, that does not usually happen. The kidney does not usually excrete glucose within the urine, okay? And this is the other reason that diabetes mellitus is called diabetes mellitus. Excessive urination and the urine is sweet, okay? So, let me draw a picture of the kidney then. So, we'll have our one kidney anyway, here. Okay, and here is the ureter, taking the urine away. So basically what's going to happen is glucose is going to start being excreted by the kidney into the urine. Okay, now this is a symptom known as glycouria. Okay, so when you start getting glucose in the urine, that's called glycouria. Okay, and the problem with glycouria is that you can't just excrete glucose into the urine without also giving it fluid, okay? So basically, putting glucose into the urine means that it's going to pull water with it, okay? Because you can't just excrete the glucose as a solid. There is a maximum concentration that you can make the urine, okay? And if you're excreting a lot of glucose into the urine, you're going to have to also excrete a lot of water, basically. Okay, so what ends up happening is you also end up making more urine. Okay, so you get what's known as osmotic diuresis. Okay, so basically, to excrete this glucose, you're also going to have to excrete water. Okay, because the glucose has to be dissolved in something. Okay, so if you're going to excrete this glucose, you're also losing water at the same time, basically. Okay, so you're going to now get osmotic diuresis. Okay, and this is then what leads to producing much more urine, basically, and therefore having to urinate more often, so polyuria. Okay, now, in addition, if you're urinating more, then you're obviously going to lose more water from your bloodstream. Okay, so the other effect of this osmotic diuresis is that blood volume now is going to go down. Okay, and that is going to activate thirst. Okay, so that's going to cause polydipsia. Okay, so that explains the second of the three classic triad of diabetes symptoms. Okay, right. Now let's talk about polyphasia. So, basically what you have to understand is that the body thinks it is starving. Insulin is the hormone that tells you when you have eaten a carbohydrate-rich meal. Okay? If insulin signaling is all the time low for whatever reason, which it is in all of these cases of diabetes that we have seen, okay, the body thinks that it is not getting enough food, and it starts these fasting processes. Okay, so remember, though insulin causes the skeletal muscle to start breaking down, okay, and releasing amino acids into the blood, okay, so you start getting proteolysis, and it also causes the breakdown of triacylglycerols within these lipid droplets in the adipocytes into free fatty acids, which are being released into the blood. Now, the lipolysis and the proteolysis of these two essential stores of energy, basically, is going to make you extremely hungry. Okay, so it's the breakdown of fat reserves and also skeletal muscle reserves that causes the polyphasia, the excessive hunger. Okay, so lipolysis and also proteolysis is going to cause the extreme hunger. Okay, now what also is coupled to this extreme hunger is that you lose weight, okay? Because if your fat cells are breaking their fat reserves down, and your muscles are also breaking their protein stores down, then you're also going to lose weight. And those two contradictory statements, that you're always hungry and presumably always eating and losing weight, okay, those contradictory symptoms, they are a hallmark of diabetes. Okay, so if you see a patient who is eating all the time but losing weight, you should think diabetes, okay, because they can't utilize their glucose properly, and that's what's causing the problem with them losing weight. Okay, right, so those are the three classic symptoms of diabetes. Another one which I'd like to add to this is that you also get ketonuria. Okay, so remember, because of the low insulin levels, you are breaking down your triacylglycerols that are stored within your adipocytes and releasing free fatty acids into the bloodstream, which are being turned into ketone bodies by the cells of the liver, okay, the hepatocytes. Okay, and these ketone bodies, they can also be excreted in the urine when their concentration gets too high, okay, and that is another symptom of diabetes, that you have ketones within your urine as well as glucose within your urine. So often when they do tests for diabetes, they will look for glucose within the urine and also ketones within the urine, okay, which can be indicators of the disease. Okay, right, So those are some of the symptoms then that diabetes presents with. What I now want to discuss is, why is this disease so bad for you? Okay, what does hyperglycemia cause in the long run? Those are the chronic complications. I'd also like to discuss some of the dangerous acute complications that can occur, which aren't necessarily because of the hyperglycemia. Okay, in fact, one of them is the exact opposite, hypoglycemia. Okay, so the one we're going to start off with is diabetic ketoacidosis. Okay, now this classically occurs to type 1 diabetics, but it can occur to type 2 diabetics and the other types of diabetes mellitus that we've discussed. Okay, so diabetic ketoacidosis, which is often abbreviated down to DKA for short. Okay, right, so you will remember that in all the forms of diabetes that we have seen, there is problems with insulin signaling. Either the insulin is too low because beta cells of the islets of Langerhans have been destroyed in type 1 diabetes, or you have resistance to the insulin signal in type 2 diabetes, okay, and then you're not producing enough insulin to cope with that resistance because of the beta cell dysfunction, okay. But there is problems with insulin signaling, okay, and this results in too little insulin signaling to the adipocytes, okay, and therefore the adipocytes activate their hormone-sensitive lipase, because remember, insulin inhibits the hormone-sensitive lipase. So if you've got too little insulin signaling on the adipocytes chronically, then what will happen is the adipocytes will turn on their hormone-sensitive lipase, and they'll be breaking down these triacylglycerols and releasing free fatty acids into the blood. The free fatty acids go to the hepatocytes and are converted into ketone bodies. Okay, and remember, the two examples of ketone bodies that we have discussed are acetoacetic acid, shown here, and beta-hydroxybutyric acid, shown here. Okay, right. So, this is particularly bad in type 1 diabetes mellitus because the insulin can drop through the floor, basically, in type 1 diabetes mellitus. So in T1DM, the insulin signaling is reduced the most. So if you like, this is in some ways the most severe problem with insulin signaling. But in other forms of diabetes, such as type 2 diabetes, such as MODY, such as gestational diabetes, if it gets bad enough, if the insulin resistance or whatever else gets bad enough that the insulin signaling is compromised so much that you get far too much lipolysis and far too much ketone bodies being produced, then it can also cause diabetic ketoacidosis. Okay, so generally, however, it is in type 1 diabetes mellitus, so this is where I'm going to focus on. Okay, so typically what happens is someone forgets to take their insulin. Okay, so forget to take insulin. Okay, and then what happens is insulin levels within the blood go down and down and down as the insulin that was in the blood from the previous injection of insulin is degraded. Okay, so you get hypoinsulinemia. Okay, so insulin falls through the floor, basically. Your body interprets insulin falling through the floor as, oh my goodness, I'm starving, okay, because remember, insulin is indicative of how high blood glucose level is, because the beta cells release it in response to glucose, okay, so if it's gone through the floor, that suggests that blood glucose has gone through the floor, so the body really does think it's in a crisis, okay. Now, if blood glucose is going through the floor, that means that the brain isn't going to have any glucose. So, what does the body do? Well, the body uses the fact that if insulin goes through the floor, then the adipocytes are going to start cleaving up their triacylglycerols and spitting free fatty acids into the blood. Okay, so let's draw this. So, if we have our adipocyte here, here is our storage of triacylglycerols. Okay, here is the nucleus here, and I'll just colour in this adipocyte in yellow here. Okay, when the insulin levels in the blood go down, what will happen now is our triacylglycerols within the lipocyte, sorry, I keep wanting to call this adipocyte a lipocyte, and within the adipocyte here will start to be degraded to release free fatty acids. So I'll draw the triacylglycerol here. So here's the glycerol molecule in green, and those are the free fatty acids, or the long-chain carboxylic acids, which are attached here. Okay, now what's going to happen is, because insulin's gone through the floor, you're no longer going to have insulin signaling, which is inactivating the hormone-sensitive lipase. So the hormone-sensitive lipase activity is going to go up, and you're now going to break down the triacylglycerols to release free fatty acids, which will go into the blood. These will then go, and I'll just put the blood here. Okay, these will then go to the liver. Okay, and the liver will now turn them into ketone bodies, which it will put back into the blood. Okay, and this is done to protect the body, because these ketone bodies can be used by the brain, okay, as an energy source. The problem is, if this goes out of control, which it will do if insulin levels go through the floor, you're going to end up producing far too many ketone bodies. Okay, so you're going to produce far too much acetoacetic acid, okay, and far too much beta-hydroxybutyric acid. Okay, and these are going to be put into the blood, and what then is going to happen is they are going to dissociate from their proton and donate that proton into the solution of the blood, and then what's going to happen is the pH of the blood is going to fall because of those additional protons and become more acidic. So pH goes down, and this is dangerous. Okay, pH of the blood changing is not good news at all. Okay, it can cause problems with the brain. Okay, so this then now is called a ketoacidosis. Okay, when the blood pH starts to fall because of the additions of ketones. Okay, and I'll spell it right this time. Ketoacidosis. Okay, now other symptoms then that it will present with are also, of course, ketonuria. You'll get ketones within the urine. Okay, now what then are the symptoms of a ketoacidosis? Well, the initial symptoms are that it's going to cause fatigue and nausea. Okay, so it's going to make you feel tired, and it's also going to make you feel sick. It also produces a very intense abdominal pain. Okay, now another symptom that's important for the diagnosis of ketoacidosis is that if you smell the breath of someone with ketoacidosis, it tends to smell fruity. Okay, now why does this occur? Well, one of the other ketone bodies that I didn't tell you about before, because it's not particularly useful to the brain, is acetone. Okay, now let me show you the structure of acetone. Acetone again is a ketone, similar to acetoacetic acid. So here's the ketone group, and then it has two methyl groups on either side. So here's one methyl group, and here's another methyl group. Now this one isn't actually usable by the brain, okay, but it's one that's produced whenever you produce the ketone bodies. Okay, now acetone is excreted on the breath. Okay, so when you breathe out, if you've got a ketoacidosis, if you've got very high ketones within your blood, you'll have very high acetone within your blood, and therefore you're going to end up with the acetone on your breath. So your breath will smell very strongly of acetone, and it gives this sort of fruity odor. Okay, so that's due to the acetone that you're breathing off, which is indicative of your ketonemia, that's the word I'm looking for, which means high ketone levels within your blood. Okay, right. And another symptom then is that it also causes Kushmal breathing, okay, which is a very heavy breathing, basically. Okay, now the reason it causes Kushmal's breathing is that when the proton concentration in the blood goes up, the protons are going to react with the buffers that the blood has. Okay, now one of the key buffers that the blood has is bicarbonate anions. Okay, HCO3-. Okay, so you have loads of these in the blood, and they are a buffer because if you put additional protons into the solution of the blood, these protons will react with bicarbonate anions, okay, and they will form water and carbon dioxide. Okay, so if you raise the acetoacetic acid and beta-hydroxybutyric acid within the blood, these will donate their protons into the solution. Now, what stops this from causing too fast a reduction in pH is the presence of a high concentration of the buffer bicarbonate. Okay, it doesn't completely stop a change in the pH, but it reduces the size of the pH that you're going to cause, pH change that you're going to cause. Okay, and the way that it does this is by reacting with the protons to form water and carbon dioxide. Okay, so now you're producing all of this carbon dioxide because of the acidosis. Okay, and this carbon dioxide has to be excreted somehow, so it's excreted by breathing very, very heavily. Okay, so the intense breathing, known as Kushner's breathing, is because you've got a lot of carbon dioxide that needs to be excreted. Okay, now, if this is left untreated, it can cause coma, okay, which is an extended period of loss of consciousness. So you can go into this unconscious state. Okay, so this is a really, really dangerous thing. Okay, if the blood pH goes down because of the too high presence of ketone bodies, it can cause major problems on the level of the brain, which can lead to you going into a coma. Okay, now the treatment then is to give insulin. Okay, because only by giving insulin will you assure the adipocytes that they do not need to be releasing all of these free fatty acids, and then by stopping them from releasing all the free fatty acids, you can stop the liver from producing this excess of ketone bodies. Okay, right, so that's diabetic ketoacidosis. We'll call it there for this video, and in the next video we'll discuss hyperosmolar hyperglycemic state.